statement, are we recording? I saw Raquel outside, so she'll be in a minute. Okay.
Raquel's coming.
Yeah, she'll be up in a second. So call the meeting to order. Great to see everybody. You know, Barb is away, so I'm trying to fill her substantial shoes today. First order of business. I think we've talked about the minutes a little bit. Any other comments?
Move we accept?
Subject to the one adjustment.
Yeah.
Move to the one to accept.
Okay. Is there a second? Second. All those in favor?
Okay.
All right, good. All right, well, let's jump in with the department reports. Start with Amy.
So the health department is super excited to announce that we will be back to being fully staffed on Monday. So yeah, our new sanitary and health program planner 1 is beginning on Monday, November 10th. Her name is Kelsey McCarthy. She comes to us from the town of Monroe.
You're familiar with
I'm
her.
very familiar with her. So I think she will fit in seamlessly.
Amazing.
Where does she live?
She lives actually up in Prospect, but she is very young and out of college only a few years, so she's still with her parents. So I have a feeling that she will be relocating.
What's Prospect near?
Like Cheshire?
Cheshire? Oh, that's way out there.
Yeah.
It's not a town we know.
So,
And what's her background? What are her passions?
so
What
she
animates her?
graduated from Fairfield University with a degree in public health. She is very into social media and creating graphics and campaigns and doing some health education programming, but she also can do the sanitarian side and do inspections. Monroe's 100% septic, so she's got a lot of septic experience as well. And she's currently finishing her food training to be a certified food inspector.
Wow. I mean, that social media stuff can be really a benefit to try to
Yeah, she's really good at it.
education and,
So,
Congratulations, getting fully staffed.
yes, thank you.
yeah, well done.
We are still offering flu vaccines for children by appointment only, so that's still out there. And then this month's data that I decided to put in was about measles. So everyone I think has heard that, measles is kind of crazy right now. It's currently in 42 states, over 1,681 cases. And one of the ways that the CDC is now monitoring it is in wastewater, which came about during COVID, but now they're using it for other diseases as well. So that is the current map of the United States with the wastewater locations that are positive in that maroon color. And then you can see the table on the second page that just tells you where they actually are. The locations in Connecticut are all negative currently. And then I also wanted to say, not only are we seeing measles, but on the flip side, it is a vaccine preventable illness. So I wanted to show you the vaccination rates for New Canaan specifically. They are published through the Connecticut Department of Public Health as part of the school program. And so they are required to be reported for kindergarten and 7th grade when the kids go into school and have their physicals. So we are way over the 95%. That is the kind of threshold or the starting number of where you want to be. And so we are in really good shape with our school system. The one thing you would notice is that the religious exemptions were at 1 for the 7th graders and 0 for kindergartners. That's because in 2021, the state of Connecticut banned or outlawed or whatever religious exemptions. So there are no longer any religious exemptions allowed, and you can only have medical exemptions. And then
Amy, do you have a sense for, this is vaccination rates for measles. Do you have a sense for how the town scores in general on vaccinations on all the other?
we're a high for all of them. We're up in the upper 90s for pretty much every single one.
Wow.
So that's really great to see. What you're seeing in some of the other states is their rates were getting as low as 80% in some of the cases in schools. And so that's why the outbreaks became so much bigger.
Russ Park, so Amy, correct me if I'm wrong, but the measles outbreak actually started in the Midwest, right? So it was in
Texas was really the
Texas
first one.
first, yes.
Mhm.
So
And now there's another one in Colorado, and then you're seeing some pop up in Minnesota. So it is traveling.
and what about polio?
We haven't seen anything yet. I know UK did have something that possibly, but anytime you're seeing vaccination hesitancy and vaccination lowering of rates, you're going to start to see preventable diseases come back. Polio is still endemic to certain parts of the world, so it's not like it was ever eradicated.
Mexico doesn't vaccinate against measles consistently, so that's
Right, so, if I looked up the, Rust Belt and I looked in the Midwest, you saw farming communities, but you also saw religious communities that were out there and measles outbreaks were occurring, polio, I think. As long as we're tracking it, which you are, so thank you for doing that. It is something, given the political nature of vaccinations right now and the CDC and everything that's going on there. It is very confusing for some people. Also, some of the actions that they're having from autoimmune, from having a flu or COVID at the same time. So I just want to make sure we're just tracking it. It's good that we're way above the 90 percentile, but it's important.
Do we track adverse reactions to vaccines?
Only
Is that-
the ones.
How is that done nationally or?
Nationally,
locally
it's
or
done
whatever?
by the VAERS system. Oh my gosh, I just blanked on that name. VAERS system. It's a CDC run database. There's been a lot in the press about it. You never used to hear about it until COVID, and now everybody hears about it. VAERS is a public interface where you can report anything. And there's no checks on that. So it's just kind of an open reporting, and then CDC takes that reporting and then they look for trends, or they'll look at specific cases for different things and investigate it further.
Yeah.
And then once their investigation is complete, then they will disclose some of the statistics that you'll see in different publications. We are required as administrator of vaccines to report to VAERS if anything happens while we are administering a vaccine.
What's your experience been? What have you seen in your experience about adverse reactions to whatever kind of vaccine?
Well, I'm not a nurse, so I've never given vaccines. So I've just kind of been on the periphery, but I
Right,
know.
but you'd be hearing about it.
Yeah, in different towns I've been in, we've had to report different things that have happened during it, whether, the injection site, something happened, or whether the vaccine, after we did it, we noticed something about the vaccine itself. So, VAERS kind of captures all of this data, and then they have to go through it and really fine tune what actually is.
Back in the day of the COVID vaccines, you were registered in the system and you got follow-up emails the
Mhm.
first day, the second day, then every week and so forth for quite a while. So,
Yes, that was a program through the CDC because I think they were so new, they wanted to try to capture as much
yeah,
data.
I mean, that was
as they
good.
could.
I mean, in the sense of getting information.
Definitely.
Thank you.
On your tick summary.
Please introduce yourself.
Oh, Commissioner Lisher
Yeah.
on the way out. Babelosis.
Mhm.
What the heck is that? And I was amazed
another-
to see it show up again.
Yeah, it's another tick-borne disease. It's not uncommon. It's not as common as Lyme. It doesn't get as much attention, but it's very similar to Lyme. So
Is it dangerous?
just as dangerous as Lyme. I mean,
Yeah.
You don't want to get it.
you don't want it, but it's treatable. And that's why it's important that people are catching the ticks early and doing tick checks.
Interesting. Okay, thanks.
Now that we're kind of getting into flu and sort of COVID season, what's the state of play in terms of best practices that's recommended from the center, and what would you recommend if all the parents in New Canaan were here in terms of what to do before this season?
Right. So obviously, we're still very much into vaccinating for flu, and making sure that, you're keeping your child home if they're sick. And just the normal things that we've been doing for years and years and years.
Yeah.
So, we really haven't deviated from that. And we do offer flu vaccines for anyone who needs them. And then the daycares and preschools do still require you to have a flu vaccine if you attend a daycare or preschool before January 1st. So that is still a state requirement.
And what's the update on COVID vaccines or?
COVID vaccines got very confusing and very political. So the state guidance with a bunch of northeastern states is basically, if you want it, go and get it. We still recommend you get it. The FDA labeling has made that a little bit of a challenge, but it's available. It's out at all the pharmacies. All the pharmacies are offering it. So
if I said to you, should I get the vaccine, you would say?
I would say consult with your doctor.
You know what the doctors are recommending? Do we know how?
Seeing how much gain
Are you
she
talking about
really has.
political?
Do we know what the doctors are recommending on that? We have a real one here?
From our perspective, the only time I'm seeing doctors go out on the limb is if you have chronic ailments or you're over the age of 65, that they are definitely recommending it. Some physicians I'm seeing ask you to alternate, if you had Pfizer and Moderna, to keep alternating that, because there has been some cases that we've seen anyway, we're having the same vaccination either has not been as effective or there's been autoimmune responses to that. So that's non-scientific. That's just what we've been seeing.
Raquel Harrison. It's a complicated topic. I mean, it's become extremely political, and that's what's probably so challenging about it. I would say it's probably, interestingly, the first thing that ever became really political about medicine in my career. And
Now there's a daily.
and now it's like just become, it's politicized all of medicine, which is unfortunate. I think it was a new vaccine, right? And so with anything new, we're data-driven people typically. And so we like to see 10, 15, 20 years of data before we make any recommendations. And so I think you're going to have a lot of hesitancy on people who have really dove into things just from there's not enough time to know. I would say I have experienced people who you're in a high risk group, it's a risk benefit analysis constantly because of the autoimmune kind of side effects that have been documented. I think what's tricky about the Veris system is people are really quick to put in things when they're acute, right? So someone has a reaction right after you give a vaccine. That's really easy to get in front of your computer and input it. But 3-4 months out, what does this due to? We don't know. Well, you got this, you got that. And so it's a little bit harder to pin down, especially when there's kind of been mass distribution of things. I think one of the things that's interesting, particularly from a mental health perspective, I think that probably plays in tremendously when it comes to COVID vaccines. What are you more fearful of? Are you more fearful of the disease? Are you more fearful of the vaccine, regardless of your political stance? And so I have seen colleagues recommend things that way as well, of kind of understanding your own personal risk benefit analysis, including your mental health and your kind of perspective on what am I willing to tackle physically and health-wise. So I don't know if that's helpful.
Russ, so I agree with Kyle. There is a cytostorm, there is an autoimmune immediate reaction, and I think we need more data, to be quite candid with you. And it is difficult working in a political environment where any data that comes out is being challenged and threatened as being too politicized. So we can only go, as we did in COVID, by sometimes looking at what our actual experiences are when you're handling that many patients at one time versus what you're reading in the CDC, which even in its best year was several years behind.
Maybe just we, as a commission, summarize what Amy just said. Talk to your doctor, let them make that final recommendation. That's probably a pretty wise.
And if you're at risk and you have a chronic disease, that those should be the individuals that you want to look at, even from a pneumonia vaccine to shingles to just about everything. But
It should be
it's an individual choice.
Yeah, it's a personalized risk benefit analysis. And, I think I say this often and in the work that I do.
You don't know what the benefit is. 'cause
Right. In
nobody's
30 years,
studying.
we will. I'll be able to take your blood and tell you, hey, you're going to benefit from this diet and this and this
Help
and
me.
this and right. But we're not there yet. And so it's kind of an individual conversation.
Now we need to talk cryogenics, right? That's-
All right, I'm sorry to beat this horse, but it's
So-
frustrating.
So why don't I'll put that on the agenda for 30 years from now.
Okay.
There we go.
Good.
We'll all be here.
We'll pick it up at that moment.
So just as one of the side effects that has happened because of the political, there was always a bit of a vaccine hesitancy, an anti-vaccine community that existed even prior to COVID. And now they're gaining a lot of ground. So what you're seeing with the measles especially is that early group who was very anti-vaccine and, got the message out and had people who started following it. And that group is only getting bigger. And so those cases that you're seeing, especially in the outbreaks, are groups of people who have not vaccinated their children for anything, whether it's a new vaccine or an old vaccine.
And that could be the opportunity for education, right? Is the COVID vaccine was completely different and new
Mhm.
technology. And so it's not, you're comparing apples and oranges by saying, oh, because of what's happened with this vaccine, let's be hesitant about every vaccine. And it's just, it's becomes a public health nightmare.
Pretty much.
In a lot of ways, because people are then rejecting technology that has been around and proven and, beneficial for a long time.
If you're actually interested in it, like I am, because it's public healthy, there was a documentary called Shot in the Arm that came out like maybe 2 years ago. It actually started before COVID, and he started looking at vaccine hesitancy and anti-vax groups before COVID, and then it happened to be filming during COVID. So it's a really interesting dive into the pre-COVID and the after COVID and the difference in the groups and how the beliefs morphed. And then it also does a whole case study on Samoa, which got almost no press, but was a very interesting study about an island who stopped giving measles vaccines after a medical error by nurses that resulted in the death of 2 children. And then the subsequent outbreak that occurred that actually ended up killing many more children. So it is a very interesting documentary about both sides of it.
And we'll leave it to this because we have a very full agenda, as you
Sorry.
know, Chairman, but it's sad, older than some of you, but to see diseases that we thought had been eradicated from the United States enough, or will be back. And as long as the anti-vax and as long as there's fear factor, if you will, anxiety and a nonsense of information coming that is not politicized, scientific information, you're going to see that continue. So that, from a public health standpoint, we should all be concerned about that, because what happens in New York State, we've seen that, will happen in Connecticut. It will happen.
Yes, 2019 was the last year of the biggest measles numbers, and that was all in New York State with the Hasidic Jewish community. And that number was about 1,000 cases.
Wow. Great, great,
All right.
great discussion, everybody, and actually relevant and meaningful. So thank you. Thank you all. Marcy.
Thank you.
Okay. I am going to keep this a little bit brief. I know we have a lot to talk about, very exciting stuff. I have 218 active clients right now. Jackie has about 164 families with 172 children. We are going to be starting our holiday baskets for seniors program. So you are all going to be recruited to deliver one. Hope you're all excited for that. The SNAP concerns, how we are dealing with that. New Canaan is amazingly generous. We have gotten $6,435 donated just in October for our food pantry. We are going to choose, rather than, our food pantry is pretty well stocked and we have figured out how to budget for that. So we are going to use a lot of that money for food cards, for grocery store cards, so people can buy fresh produce and protein, because they're only going to be getting half the SNAP amount this month, and it hasn't even come yet. I don't know what's going to happen in December. So we are going to make sure that anyone who uses our food pantry and who actively is a SNAP participant can get produce and protein.
Marcia, do we know how many actual people are
Yeah.
SNAP users or?
In this town, we don't, because there are some families who use SNAP who qualified for SNAP and applied for SNAP, not through us.
Okay,
So our food pantry numbers, let me give you those.
yeah, I saw those.
You saw
Those
those.
seems to be
So
growing and.
They
healthy.
seem to be growing, yeah. And so we have about 134 households
Right.
and they are SNAP users, but that does not mean
Right.
that is our only, but they are aware that they can come. I mean, we've been trying to put it out on social media and stuff that anyone who is a SNAP user can contact us and not become
Jim?
our clients.
I was going to ask, Lisher, going to ask two things. One is that I've probably gotten no less than 5 solicitations from other nonprofits around the state looking for help for their low-income customers. And I'm wondering if there's anything you see in the horizon that bodes, I suppose, a major spike in the SNAP usage here. And again, we're in great shape here, but these other nonprofits, Bridgeport, Hartford, New Haven are not.
Well, no, I mean, not currently. And Governor Lamont has granted a large amount of money to go to the larger food pantries.
Yeah.
That will hopefully trickle down to the smaller ones. And if not, the larger food pantries will accept, you know, like even person to person and the food pantries in Stanford, they will accept non-residents. We are just a super small food pantry
Yeah.
who only accepts New Canaan residents, but there are larger food pantries who are being funded. It's just, we have to get those addresses out, and we do share those with people because like person to person will do produce and we'll do some proteins. So the larger food pantries have the ability to pass.
But the town is prepared for that 27% of the people that we
Yeah.
identified as low income. that
We
have some
currently are,
concerns.
currently.
Yeah, gotcha.
But we will put, you know, a code red out if
All right, great, thanks.
that's ugly. So, I'm gonna keep that, if anyone has any questions on the report, otherwise I will move on because I know we've got like a bunch of stuff to do. I put in front of everyone this, we reworded and we've tried to, we could not find the correct cannabis leaf. We could not, so we decided, you know what, let's just completely reword it. Maybe people are bored with,
I like this better.
oh, I'm so glad, good, I'm glad. So if we, Mr. Chairman, can make a vote to put this in the newspaper for our holiday announcement, that would be fantastic. I will tell Enza that we all approve of it. If everyone likes the wording and
Who did?
oh, Jen, I'm so sorry. You know what?
Oh, no, it's totally fine. I just couldn't tell. It was silence
see.
and I was gonna ask, do
No,
we
I may
need to
have-
make
I
a
may
motion
not-
to approve?
I may not have scanned this to you guys, but it says, make safety your priority on the roads this holiday season. And then we say, are you concerned about a friend's or loved one's drinking, cannabis, or drug habits? Are you worried about yourself? And then contact Al-Anon or Alateen. And for help with drug abuse, reach out to the Substance Abuse and Mental Health Services Administration, and we give their helpline. And for additional resources, we give our phone number. And then we wish everyone a happy, healthy holiday season. It's a slightly different
Sounds
ad.
great. Yeah.
I will scan that to the non-attendees. I apologize. It was kind of just
Totally
me
fine.
this morning.
I trust you guys in that room. It's fine.
Okay.
But do we need to make a motion to approve? Does it need to be done officially like that?
Well, I don't know. I mean, I just want everyone, I mean, I think so, because I want to put it
Yeah,
in
I
the
think
news.
Yeah, I
so.
think
Jen,
it's gotta
Jen, I
come.
just emailed you I took a
Oh.
picture of it. So it's on your email, and John too.
Thank you.
Thank you.
Mr. Digital.
Exactly. So fast and
I'm
efficient.
getting it.
So we probably need a motion from a
Yeah, do you
commissioner.
want to give them just a brief second?
You want to take a look at it?
And maybe go
Yeah.
to another topic. always-
Okay, and then the next topic is our holiday gift program. I know it doesn't seem like it's very close, but I've been told by my college sophomore who still makes a Christmas list that there are 50 something days until Christmas. So we have only received $225 to the holiday gift card drive. So we are going to put will you email that to them also? Because we just created this
This
morning. also.
note
This
here?
one?
Yeah.
We are asking for gift cards. We try to give up to $100 per child up to 12th grade. And that is given to all of our food pantry members. Just this morning, we got 2 new auto assistance families. And both of the people who applied for the caffeine and carburetors auto assistance also have young children. So now they have been added to our list. So We have about 85 kids who need $100 each. So we're really gonna put this out on social media and maybe we will ask.
So that's the
we can
fundraising
ask-
target?
Yes.
10,000, something
Yeah,
like
well,
that? total?
8,500 is our goal. Yeah.
Okay.
So anyone who wants to give, Jim was our first check. Thank you.
And is the button still working?
Absolutely. Our donation portal is there and there is a holiday button and then there's a most needed button. And with that, if you want to just give to most needed, you can do that and then, trust us to.
Commissioner Barksdale, I'd make a motion that we run both of these in the paper to try to generate
Great.
with 50 days left before
Yeah.
the end. I think would go a long way to and make sure I put a check in there as well. But we would go a long way to stimulate interest and concern. And so I make a motion that we include these in advertising.
Okay,
That's
all those in
great.
favor? Great.
Yeah.
Bye.
In our budget, Daisy, thank you. I appreciate it.
Don't leave them out. Don't leave them out.
No, I won't leave you guys out. We ended up in our budget last year asking for 15,000 for our human services budget that we hadn't been asking for and hadn't been receiving because we sort of had a stockpile of money. And we have almost spent all of that because even our back to school program also, I think everyone's very stressed. Everyone's very busy with their own lives. And I think back to school got sort of forgotten. So we ended up spending 8,000 of that human services budget on gift cards for back to school.
Yeah.
The one thing I would like to modify, if you can, if you think it's appropriate, the gift card from Walmart. Walmart is not in our town, so that is, for someone to go and find a Walmart. Is there a way to just make it an American Express card?
Okay, so I think with American Express and Visa, I think that there's a charge. I think that's,
The other thing I was gonna say is because, Walmart was closed, but it's not anymore, maybe it's just Target instead.
Oh, other ones, there's,
107.
that's just one side of town.
yeah, and then there is a Target. I mean, we could say Walmart or Target. I also think you get more bang for your buck at Walmart or Target, or maybe we could do even Amazon cards. We could,
Well, I just thought it's
Something
something,
like-
the dollars could be stayed in town is number one. Number two, I think about transportation
right,
for people in town. So if
think
I will go out, if there is a difference, I like Amex because you can use it anywhere that you need it or whatever. If there is an additional charge for Amex, I will personally pay for the
okay.
additional charge.
I mean, I think it's for the purchaser who
Understand.
buys it. Yeah, okay.
Oh, the purchaser, you're not giving them the gift card?
No, we give them the gift card, but I think say you buy $100 gift card on Amazon for American Express, I think there's a charge. I think it's really 103 or
And,
whatever.
and what I'm saying is I will personally
I
pay
think we
for the
would take-
difference
yes.
between the two. Just so that they able to use it wherever they want to use it. And if they need it for food, use it for food. If they need it for supplies, use it for supplies. So I'm happy to do that.
Okay.
John, I know you were one of the first guys to use the button and everything like that. I think you're still a fan of that. I'm wondering if it makes sense to publicize that again.
Oh, we always put that on our Instagram, when we post something, I posted for Snap, we also we mention that in almost every post, yeah. So on our drive for gift cards for the holiday program, we will mention that.
Yeah. I'm
Absolutely.
just wondering if there's another burst that we could do that's outside of, it's not everybody's gonna be on the Instagram because it's such a cool thing.
Yeah,
And there was a good reaction when it first came out. And I just wonder if it's drifted out of people's consciousness a little bit.
well, that's almost how we've gotten most of the 6,000 for the food pantry, believe it or not. So people are using it.
Yeah.
But I could ask Mike Dinan maybe just to put a quick blurb.
Yeah.
Just a reminder that it's easy to donate to human services.
Yeah, John, you've always been a big fan of this. Do you have any thoughts on it?
No, well, the only thing I was going to ask is, for some printed materials, you could also consider whether there's a QPR code or a QR
Yeah,
code.
Enza can make that, yes.
Yeah, because for the ambulance corps, when we do our mailing, we have one for Venmo and we have one for the credit card donations. So to help facilitate things.
Yeah, okay.
Yeah.
I'll mention
Kind
that.
of along those lines, is there a mailer that goes out on behalf of Health and Human Services to residents in town?
No, we really rely on like New Canaanite and social media. We don't have a large budget for mailing, and I don't know how that would work. I don't know if we would get that from like the voter registration or,
Yeah,
You
I'm
know,
just
we've
curious,
never
because a lot
done
of the private nonprofits
mass
do
mail.
that, and I think it's a nice, like, if you're, you know, kind of keeping track of what comes in, and then you're like, oh, end of year, who am I
wanting to give.
wanting to give to? It can be a nice reminder, depending on how people organize themselves.
Okay.
Commissioner Knight, for us, it's about $5,600 to do a townwide mailing.
Okay.
So it can be expensive.
Yeah.
And that's like bulk mail?
Yeah.
Yeah.
Okay.
And then you
Uh,
also factor in the cost of the actual mailer too.
Yeah.
So it does get expensive.
But it's definitely a thought.
It's an interesting,
Yeah.
I would be curious what the return is. So if you're, what's the return typically for you guys, John? I don't know if that's something you can mention. But,
Well,
you know,
so we only do it's a soft appeal. So a lot of organizations are much more aggressive about it because we're an all volunteer organization, and we also get some 2/3 of our expenses are covered by the town, but we get anywhere between $160 and $200,000 in donations. We
Wow.
get approximately 80% of-
return.
80% are still in the form of checks. And a number of the donations also come in from people who we've provided care and assistance to, either currently or over the years. So it's a little bit different
Right.
beast,
Yeah. no,
Whatever.
it is.
but yeah.
Okay. Great, lots of food for thought, and I just think there's a big support for the button, because it's really a great way to get
Yep.
generosity funded, and not at big volumes, but it can really make a difference.
Yeah, no, I will absolutely
Yeah.
talk to Enz about that, and she can bring it up with the communication. We have to approve everything with the communications
Yeah.
committee, but we will definitely, I think, do
Cool.
another announcement of the button, just.
If you do, Commissioner Barkston, if you do decide to do a mailing and you have certain parameters that you want to say, okay, a net worth of so-and-so, because you want to go to the high-end individuals, so you're able to get that, we have that database.
Okay.
So we're happy to share that database with you, and that way you're not doing such a broad
Sweet.
sweep of the entire town. You can identify the 1,000 people, and then it becomes less cost effective, but you have a larger return because you're hitting the people and asking them to go to the.
Yeah.
These are people that are waiting, state planning, looking at their taxes, getting near December, and they go, oh, this is a great idea. Let me send $1,000.
Yeah, and then I actually don't know if I would have to ask the selectmen, like, I don't know if are we like allowed to actually fundraise the way like private organizations do? Like, I'm not sure.
It can be it
Those
can be
rules
just an
are-
awareness piece.
Yeah,
With here's a button.
Right.
I'm not saying it has to
Right.
be
That's a elegant,
right, like, I
approach,
don't
yeah.
know if we can do like an actual like appeal, like the other. But yeah,
okay, great.
okay,
May
So-
depend on what happens with SNAP,
yes,
but to stay ahead of that
would be great.
would be
Yeah.
helpful.
We only have 2 people.
40
Stop, God, I haven't eaten about wrapping paper.
Anything else, Marcy?
No, I think we can move on to the fun stuff.
Yeah, let's move on to the grants, and Marcy's gonna take us through, there's a lot going on this year in terms of shift of strategy a little bit, which I think we can talk about. I think for today, we're very early, like in the budget process, because other folks aren't seeing this for a little while. I don't think we're gonna be definitive today, I think there's a little more information gathering.
When do we have to actually render a
Well, I'm meeting,
decision?
I'm meeting with the finance department in December, and then I go in front of the Board of Finance in January, Board of Selectmen in February, and the Town Council in March. So it is actually sneaking up on us.
It is, I think because today is going to be surfacing questions and reactions, and we'll probably need to do a little follow-up. I know we need to do a little follow-up with Silver Hill as one area. So I think this is surfacing issues and questions, and then we can probably be definitive meeting in December. I suspect your meeting in finance is going to be after the meeting. Let's check on that.
Okay.
Marcy, so Commissioner Knight, Marcy, I know for EMS, we had to submit preliminary budget information to the town by this Friday.
Right.
Yeah.
I did
okay.
that. Yes.
Yeah.
Yeah.
Okay. And did you then, for those purposes, just put in what you were recommending here as a placeholder?
Yes.
Okay.
Correct.
Thank you.
Lesher, have you talked to Deanna yet and the selectmen about early budget guidance, I guess I'd call it?
She would like us to remain as we are.
Flat. yeah,
Yes.
Okay.
Yeah.
Well, that's good.
Yes. I mean, she hasn't cut us.
So with that, why don't
Okay.
you take us through?
So Domestic Violence Crisis Center, they have requested 10,000 as they did last year, and I'm recommending the 10,000, and that will, excuse me, be given out of the town budget. The Get About, also the same as last year, 50,000. And that will be 25,000 from the town and 25,000 from the Connecticut Department of Transportation, the matching grant program. That is continuing until 2028 when we have to reapply. Meals on Wheels requested 10,000, and that will come from, where are we? Where's Meals on Wheels? They requested, why does it say 10,000? It should say 5. I'm so sorry.
It says 5.
They've always done
Does?
that.
I'm looking at the summary page.
I'm looking at the summary.
But the
I'm
actual
so
details-
sorry.
I have a
Yeah,
spreadsheet.
this is,
Well,
this,
that's
this,
right.
yeah,
You're
this-
in the details.
We're in the.
You're in the weeds there.
the spreadsheet's amazing, so I think
Good.
maybe just use that as your.
We can use that. So they have requested 5,000. We are giving 5,000. I recommend 5,000. New Canaan Cares, they have requested 22,000, a slight increase from the last couple of years. I looked at their numbers, and they do have quite a large amount of money at the end of every year. So I recommend keeping it at 18. 2,000 from New Canaan, 10,000 from the Youth Services Bureau grant, and 6,000 from the opioid settlement.
Marcy, was there a specific reason they asked for an increase?
Just like sort of an inflation reason, they were saying like, the 2% over the last couple of years, it came to like 19,800 something, or
Have they expanded
21,900.
have they expanded what they do?
No, and they do amazing things. No, they
No, no,
haven't
I know that,
expanded,
yes.
but they're still
Yeah,
doing
good
programs.
people.
But like this year, with the 18,000, we also gave them an additional 2,000 for Narcan. And then they're doing some Narcan training. So I mean, it doesn't mean that 18,000 is gonna be, like, we can still give them other things throughout the year for specific initiatives, yeah. So I'd like to keep it at 18.
I
The
have a-
assessment,
A question on the status, I guess, of the behavioral health audit on youth. Where is that in the discussion point between the foundation, the Board of Education, et cetera, because if that's going to take place, that'll get a lot of attention or generate a lot of awareness.
I do not know.
And New Canaan Cares Service, I would
Yes,
think would go,
I have not
or need it.
heard, I have not heard from New Canaan Cares about that at all. I
I
don't
mean,
know.
the foundation is kind of where the survey next steps are happening. They're doing serious work and working with the Alliance and all of that. And I think, you know, we're watching, but they're
doing.
driving the leadership, and it's actually, what can you say, it's working great. But I
It's
think,
not going down as cleanly as the adult section of the adult survey.
Well, it's tricky.
Yeah.
yeah, they're different. The school system, yeah,
It's under control.
well, it's being seriously worked on, and that I know. I just don't know the exact update.
Yeah,
But I
no,
think
I'm sorry, I
it's
don't
in
know.
very good hands, I'd say.
Do you want to go through all of them, and then because we've got, I think we have some serious questions that we need to
Yep.
go
okay.
through. So if you want to go through your full.
All right, I'll do my last one.
Sure.
We only have 5. So the assessment program has requested 40,000. And I suggest we continue with that, 15 from Human Services and 25,000 from our opioid settlement. If there is any concern about that opioid settlement money disappearing, it will not disappear in the near future. We currently have $344,675 in the account.
Oh, that we can draw on?
Yeah, that we're
Oh.
drawing on. So.
Do we earn interest?
But is the we town or the human service part? Because there was, a year ago, that was an issue. Because the town controls the.
Yeah.
Or the Board of Selectmen control
Yeah.
that budget.
But we can draw from that
Okay.
as
good.
long as it covers, opioid-based services. So, and we are going to be getting more.
Tom Ferguson, I just would recommend we get a case count reports from the assessment program for the current year, just to make sure it's still connecting to a
Yeah.
sufficient number of people.
And we're going to have a meeting,
Yeah.
Marcy and I probably soon with them,
Okay.
and come back with a bunch of
That'd be great.
data.
Okay.
So yes, it's absolutely.
If I may, Commissioner Barksdale, I think there's two important things from a high level. The first is I believe all of these fit within our priorities that we voted upon a month or two ago. So that's great. So I commend you and your staff for doing that, Marcy. The second is I still believe that we need to be able to measure effectiveness. And that gets to a little bit of what Tom was requesting of what our actual data and stats are. So I'll give you one example. When we look at the domestic violence, they were very specific on 68 New Canaan residents with 17 having lap screenings. 11 out of the 17 were assessed at high risk, and high risk being risk of homicide.
Mhm.
Okay, that should be alarming for all of us. If you look at our history, just within the last 90 days, that is extremely, I think, challenging. We talked about, you providing some service. I don't know if you had a chance to do that and reach out to some of the restaurateurs in town. But if we're measuring effectiveness and we're measuring demand and impact, that's something to me just screams, help and support. And maybe part of it is that we're seeing these kind of numbers because of education and because of empowerment and people feeling empowering to call and reach out. But those are some alarming numbers. The second is when we talk about vulnerable populations, I know you mentioned about 104. I think over the next couple months, maybe we can take the vulnerable population and break it down into, here's domestic violence, here are lap scores that we're seeing through our police department or first responders. Here is the Silver Hero program, which I was involved in with Andrew and at the time the first selectman, for that age group that was in high school up to about 20 years of age, to see the percentage, even though we don't have hard data. I know they're producing hard data to us every month, but we don't have it here. But from a percentage standpoint, only 51%, right, out of New Canaan were in that 0 to 18 years of age group. So now you're seeing about 11% being in the geriatric community. And so again, it gets back to me, effectiveness. One on Silver Hill is if you look at their financial statements and go through it, their charity care has dropped from like 1.2 million down to $571,000. You know, that's charity care, which I know some of this was set up to provide free care or uninsured care. Get About puts in that the town cut its support by half. I didn't see that in the financials, but that's in their narrative. So I'd really like to get to a measurement of effectiveness for us, and as we're putting money in, what is our expectations in terms of what we're seeing and how many families we're impacting. So I'm trying to create kind of a matrix, for lack of a better term, for which we can look at these and say, here's an effectiveness point of view, here's a priority. But I commend you that all of these are worthy. All these fit within our priorities. And if we are limiting our budget and haven't limited our budget to be flat, then it even makes more sense, I think, to have those critical.
I'm confused about
Sure.
the Get About. We have not cut it 50%.
I agree, but if you read the narrative,
I'm gonna have to reread it. I didn't.
yeah, it is in
Is
the, if someone has it here, it's in the first submission. Paragraph is about halfway down. It states in that narrative that their first page of their submission that the town cut its support in half.
Okay. We did not.
I thought
Right. It may be coming from a different source, but it's still the same amount.
But that may be what I was
Yeah.
potentially curious about, is what would be interesting for me is to understand what percent of their overall grant stream, budget, whatever, our contribution is, right? Is Forget About, are we, 10% of what they get, but for New Canaan Cares, are we 2%? It would just be interesting in terms of like, because I think it goes to how much we can ask them for, kind of a statement of returns, right?
Right, yeah.
I mean, is basically what you're saying,
Effectiveness, taking a
effectiveness.
return.
And so, if we're only 2% of what they have coming in, how much do we have the ability to say, hey, listen, here's our priorities list. This is where we want you to focus. We have less sway in that. It would be my perspective on it, right? So, we talked about AI and the gambling and the emerging things there for young people in the priorities list. New Canaan Cares would be a great place to say, hey,
Right.
this is where our list is.
Those are the things though that we could fund with the if we have extra YSB grant money, if like an amazing speaker comes up and they want to like present that at the library or at the high
Right, and
school,
we can-
that is something we can financially support. So it's, that's a hard percentage to figure out because like this is the flat donation, but then there may be like opportunities.
Yeah, but to
throughout the year.
Raquel's point, and I agree with her 100%, when we're giving these monies, we can also say we'd like the monies to be spent towards and maybe give higher priority to some of the things that we consider.
Yeah.
To go back to New Canaan Community Foundation, some of these grants, and I'm sorry, I'm the one that read through everything, did mention they got money from New Canaan Community Foundation,
Yeah.
right? So we're in the analysis phase. We're good at polling and getting surveys together. I'm not sure we're good at, as a town, and that's putting myself there as well, coordinating, collaborating, and putting and aligning with New Canaan Community Foundation is putting this amount of money in already, and this is their priority as well. And we're just a small piece of the bucket that's already being funded. We're looking at effectiveness from our perspective and saying, we'd like, New Canaan Cares, here's $1 but here are our 3 priorities. Here's the effectiveness that we'd like you to measure and report back. Maybe that's too granular. But that's how I like to, me personally, like to look at it, because that allows you to go upstream and really look at some of the preventive measures.
But I think too, you don't even have to get overly detailed about it. It's a simple, like, here are our priorities. Can you let us know which programs you've done in the last year contribute to this, right? Just so we also feel that accountability, that we've had that back and forth. I don't think it has to be itemized, especially if we're not necessarily a big part of their budget. It'd be nice to have it.
Listen, I think it's part of the equation, measure where we can. We all know that influence is our major currency. And I think it's actually, they're very important statements of town intent, where we put money. And like symbolically,
Right.
like for these organizations say, oh, by the way, the town also supports us. That's a very important message for the philanthropic community and all of that. And I just want to make sure that even if we're just a small part of the budget, me personally, that's not wasted money.
Mhm.
Because that's a really important talking point, a validation that these organizations are important. So I have a little different view, like the 2,000 here and there, what are we doing? I'm like, well, no. That is a statement of validation from serious people, including the top people in the town, which is an important signal to everybody else that these are good organization and worthwhile organizations. I mean, Russ is right in the priorities and all of that. But also, I think it's important from almost a texture point of view that we are looking at the numbers and we are looking at data to the extent we can. Now, can we wrap their knuckles? And can we make a lot of data requests when we are 1/50th of the budget?
Right.
Not really, but we can signal broadly that they are part of big priorities, and that is the impact we really can.
We are,
Speaks to
we're a
alignment.
big piece of Forget About, we're a big piece of New Canaan Cares, and we're a big piece of the assessment program. Domestic violence, no, I don't think so. We're a smaller piece, but it's a really
Very small.
major need. So, that's, Meals on Wheels, I'm not sure, but I do think Get About was historically, the town funded 46,000-50,000. The Connecticut Department of Transportation was always a separate source and always at 25,000. So combined, it was about 75,000 of government support. Now, it looks like we're going to 50 here. That seems like a cut to me. I don't,
Not since I have been
But
here,
that's
so I
just-
don't know when that cut happened.
Yeah,
I
but
mean,
that's,
it's been 6 years
my-
of 50,000.
the commission in the past always approved 46 and then it jumped to 50 one year, I think.
Did
and
it
then the
approve
state-
50?
25 was in addition. So this,
I'm gonna have to look into that.
Yeah,
I'm sorry,
it
it was
just-
before
and
I was even.
it's
in
early,
New
but
Canaan
it just
because
looks like a cut to me.
I don't.
But to Peter's point, what we do have is the ability to influence, right? So even if it is 2,000 or if it is 3,000 or 5,000, the fact that we would bring attention to the domestic violence issue is an important piece. So it may not be the number of zeros necessarily, but if I've never seen these numbers before.
Well,
I've never seen LAP numbers before on a monthly basis. And yet, let's go back into what has happened in the last 90 days, right? We should be paying attention to LAP numbers that are coming out of the police department.
And the DVCC is countywide, or at least half the county.
Mhm.
The others are basically New Canaan only or mainly New Canaan.
Mhm.
So it's a little bit of. different-
Tom, I couldn't agree more.
Yeah.
The only point is, reading through the details, 68 New Canaan
Oh,
residents.
yeah,
Yeah, I mean, that's identified as in our, and why they may have a larger geography. I think we have to bring more attention to that issue.
Yeah, and I think it's
it's just that the 57,000 human services looks really paltry. For the coming year compared to historical amounts we've allocated, even if you pull out the kids in crisis.
As a build on that, this town is sitting with six-figure reserves out of the opioid settlement. We, as human services, are uniquely qualified among all of the town departments to be able to tap into that. So strategically, we ought to be thinking creatively about how to use that opioid money, because I think it has a fuse on it. One of you guys may know, but I think it runs out in another 18, 24 months. And I don't want to lose it if we could use it for human service.
Well, what I heard Marcy saying, correct me if I'm wrong, I don't want to mishear Commissioner Barksdale. Those funds exist
Mhm.
right now. So
Correct.
it is really, for me, it is empowering our team with our priorities, their support, real data. So when they present to the Board of Finance, here is real data. We're just not going in and asking for this because it's good, because we love the programs and everything, that we are laser focused and target. Because if you go to the Board of Finance with laser focus and target, it is much more difficult for the Board of Finance to say no than it is to, we're going in specifically with a priority that we've identified and with actual number and stats in terms of impact.
And I think it's important for the organizations to understand that their numbers are not changing. I mean, they may look smaller on our budget because the money coming from, like, quote, the town looks smaller, but they are all getting like what they're asking for, except for CARES. Do you know what I mean? Like, we are creatively figuring out a way of making sure that they are getting what they've requested and what they need. So, I want that to be clear.
It's a really important point, because I think that's what the Get About.
I wasn't sure. I like to
But I think that's
confirm
what-
that, that's all.
But I
Yeah.
think that's what they're focused on, Tom. That's why they're cutting it's being cut. But
Right.
we are actually responsible for directing the same amount of money to them. It's just a different.
Yes, it is just coming from different pots. John, sorry.
So I
I agree with that.
John,
I hope that's true.
Commissioner Knight, I was going to say, at least with some of these, another way, in addition to the points that Russ has made and Raquel has made, when we were thinking about the seniors issues, and we'll be coming back to that at a later time, but at least as an example, with Meals on Wheels, that may be a way of communicating with a population that is homebound. And so, we may have a vested interest in, when we come up with, follow through on the recommendations of, in a sense, partnering with Meals on Wheels or partnering with Get About, or looking at New Canaan Cares as programming for the next year. And if we see there are gaps in some of the topics that we think might be relevant for the community, we might have an opportunity to sort of work with them, so that with a different way of pointing out how we might either influence or partner with some of these organizations and why we think it's important to fund them.
Right. Yeah, I think that there are strategic questions here about what's happening with the budget. One of them is funding from different pockets and feeling okay that they're getting the same amount. And one of my questions is, well, when those pockets are not there, is our baseline funding going to be the 57,000, and it's going to be a real reach to go above that? And I'm kind of concerned about that, because we don't want to be back. I don't think we want to be backing away from services. This is probably what's nagging at Tom as well. So I think that's a strategic question for us to be asking about. But if there's monies, which there are, Marcy's doing a great job of finding these things, I think that's great. And then I will say the signaling component and the strategic component that John is referencing is also quite important. And, DVCC, the signaling of that being in our budget, I think is very important, because we think it's an important sort of issue. And so I think it's a bit of a longer discussion, probably with all the other folks in town, about what this is all about. Yes, it's about the data and the efficacy, but there's also the signaling component And even if it's a couple of grand, we are saying, we are voting with our feet that we think this is a priority.
But I don't even see it as just a couple grand. Like, I see it as that we have just found a way of funding them differently. Like, do you know what I mean? Like, so it's not just that we're giving CARES just $2,000. We're not. And I don't want to hoard that money that we have. We have this grant money. It should be used. And we still have to worry about taxpayers and
Yeah.
budgets and.
My point is different, because you're right on these here, but there
Yeah.
was a list that was longer.
Mhm,
And there was a lot of discussion about 2 grand here, 2 grand, what are
Yeah.
we doing?
right.
And I'm gently raising the issue that small grants and maybe a few more folks might be strategically important, because I think everyone's taking care of the core ones here. But I know there was discussion about, are we just dribbling money out, drips and drabs to a water, and is that intentional and wise? And I don't know if it was or wasn't, but there's a role for small, quote, investments by us that's strategically vetted, probably much more than it was in the past, about areas that we want, like if we want to do something around something toward a gambling thing, technology in schools, or whatever the other issues that we think are actually really important. Not for now, because I think we're good. This is what we have for now. And, you know, I think the first selectman is signaling this is right. It feels generally okay, but I think we all want a little more time to digest this before we affirmatively
Well,
vote. 'Cause
I would
questions are
ask,
still
are there priorities that we think there need to be spent money on that are not encompassed by these 5 agencies? Or do these agencies cover the range of needs? Now, maybe they need to add some programs or something like that, but do we need more agencies because there are needs not covered by these, addressed by these 5? And I'm not sure we do.
I think we've narrowed it down that these 5 cover.
Yeah, I
our-
mean, Commissioner Barstow, I remember a time, not that long ago, maybe 3 years ago, where we had a larger net and we were giving smaller amounts.
Right.
And we as a commission came together and said, why don't we be more effective and move the needle in our priorities in the areas that we consider a priority? And I think that's how we got to where we are. I agree with John that this needs to be ongoing, right? Needs to be an ongoing engagement and strategy, and maybe not sitting here once a year going, you get 10,000 or 5,000, but we're ongoing communications with these agencies of how other ways that we can partner or help them raise money or find other funds. But from the selectmen's point of view and the Board of Finance point of view, and from a taxpayer's point of view, are dollars being effective and going towards where we consider high priorities? And I think that is the lens that we should be looking at. I can't commend you enough to finding alternative buckets so that it is a more comprehensive. It's not just, 123,000. Here's other areas that make up with the 123,000, so we can be prudent in our strategy. But I personally believe strongly that in terms of measuring effectiveness, if we are going to be voting upon giving, I'm just using Silver Hill not to pick upon Andrew Gerber and the great programs that they do. If we're giving them X amount of money, does this say that for the 0 to 18-year-olds, we'd like to see growth, or we'd like to see data indicating our effectiveness on that population? When it comes to domestic violence, please report to us every month what the LAP is, and if we have to help create it, if it is a red flag that is going up, and I personally feel it, given the past 90 days, it is a huge issue. Should we know that? And so that we're giving you money, but please report back to us monthly what the LAP and high risk numbers are. Hey, John.
I would just ask a question regarding the assessment program, because it seems to me it's a little bit of a different beast in that it was a partnership with the town, I guess, fundamentally through the Department of Human Services, but at least that one, to me, there's an investment originally by Kevin, but with the town generally that seems to me is different with CARES, Get About, Meals on Wheels, and DVCC, and that the funding just is coming through us, but it was really intended initially as a partnership along with the Community Foundation. And I think, I mean, Marcy, I don't know how you feel about it now, whether it's sort of fully vested with you, but I think hopefully the Board of Finance and the Town Council are a little bit more invested in that than necessarily, let's say, Meals on Wheels. And I think everyone has questions with the assessment program, at least I know the Community Foundation does, is, you know, is it going to become, is there going to be the opportunity for the town's participation and for the Community Foundation's participation to wind down over time, or whether, you know, it's effectively a multi-year grant?
Commissioner Barksdale, you're correct, John. The initial grant was in 2022. I believe it was July. It was a $250,000 investment, and there's been investments in that going forward from different sources, but we don't have those stats to see in front of us, John, in terms of we only thing we've seen thus far that's been presented has been percentages.
Yeah.
See you next month. Good
Okay.
discussion.
Yeah, I think really, really good discussion. I think Marcy, I think, has done a great job of taking in lots of different input and making sure the major sort of programs are funded the way that we would like them to do. There's still, I think, the lingering strategic questions because, you know, collapsing down the number of folks, I don't think that was a strategically sort of, that kind of happened.
Mhm.
But without like, what is the real purpose of this set of grantee budgets? And I'm trying to introduce this other notion of leverage, where a couple grand from the town can open up and is a much more powerful way of supporting these smaller organizations than one might think. Because that's that kind of validation. And I don't have ones in my mind that, oh, we should be, but I think we should be open to that. And to John's point, there's different strategic pieces, ones that, okay, that we really founded, like the assessment program, the other ones that are really fundamental, that really rise to the top, which are the ones here. And then maybe there's this other category where we're signaling to the philanthropic community and the foundation and everybody else that we think these are emerging important areas. And then you see there's sort of an overall strategy guiding it. And I think the piece of it's part of our priorities, we're looking at efficacy. And there's also this, maybe possibly the signaling component that this town cares about, and everybody who's part of that organization, well, you know what, the town actually gives us money. That means something. Then you can start to see a strategy that is a little clearer, because Marcy's been thrashing through, trying to figure out all the different inputs that people are getting. And I think as part of this, we can possibly come to a more refined approach that takes aboard all the points that everybody's making and showing the suppleness, right, of using the other funds. Russ's constant point of measurement, that's just good governance, period. No, but it's a key part of it. And I think we've got to be pretty deft. And this gets to Raquel's point about we can't be hammering folks, but as part of our influencing, people like to get good questions. They do. That's not an imposition, I think, tonally. We can't be hammering them, especially because we're, small piece of it. But I think our spirit and culture here is be very collaborative and value add. Just I look at the temperament of everybody in the room here. That's what we're all about. I think we can be great partners. And the money does give us a little bit more opening to ask some specific questions and make a couple of judicious requests for information, which I like. So, I mean, there's a real path forward here that I think I can see Board of Finance being supportive, Deanna being supportive, and also. So I think that's where we're going, and, maybe we can close it out with a big to be continued.
The only concern I have is kind of, part of our role and job is also empowering.
Yeah.
Right? And I want to make sure, because we've been down this pathway before
Yeah.
with the Board of Finance and the first selectman, not that long ago, that we need to be very specific and empowering. And I think that giving her that strength and that specificity on targeting, and this is why, and justification will do, and I'm knowing words in your mouth, will empower you the next level, and the next level you have.
Yeah.
My commission has said, these are priorities, these are why the funds are targeted. That's going to be very hard to fight against as compared to something that's more nebulous and, soft spoken. We're trying to do this for the community. Well, you know what, you could argue there's a lot of community that's out there, Canaan Community Foundation and others that are trying to do the same thing. So the more targeted we could be, the more empowering we can be for you. So when you go to them for the Board of Finance and you're asked very specific questions, which they will, as you know, that you're empowered with that. And that's for me is extremely important.
Great. I think that's a great final statement. And again, I think we probably close on both of you guys, really thoughtful discussions. And Marcy, navigating the last year, because it's been a little tricky, but you've come out with like a really great product. And I think it's really strong, and, we're excited about the way you've done it. And
Thank you.
I think we're going to try to clarify with other folks the specific directions, as opposed to reading tea leaves and all the things you've had to do. So it's really clearer. And again, to use data so that next year it's going to be really.
Don't use tea leaves at the Board of Finance. All right, I'm just saying.
Oh, no, listen.
But we're blessed to have as much talent as we have. So
Yeah.
to both of you, and with your permission, motion to adjourn.
You need no permission to make those motions.
Okay.
Okay, thank you, everybody.
Thank you
Thank
very
you.
much.
John. Thanks. Have a great day.